There can be and have been some cases where individuals take too much of a particular medicine, and a good example would be paracetamol, which is in a number of branded products for treatment of cough and cold. And they might be taking paracetamol in perhaps medicines that they've been prescribed by their doctor for pain. So there is a danger that they could overdose on paracetamol, and it doesn't take much for that to happen. So it's an opportunity for the pharmacy team to make the individual aware that a product has paracetamol in it, for example, and that they should take care not to duplicate that particular medicine in something else that they're taking. The other issue that the pharmacy team and pharmacists can help individuals with is if medicine contains something that perhaps might interact with something that they're already taking, or that they have some condition that might impact on the way they react to that particular treatment. So the treatment for colds and flu for children varies a little bit from that of adults in some instances. So, for example, children under 16 should not be given aspirin, but they can take, for example, paracetamol and or ibuprofen to help with some of their symptoms. And there are very few things that you can use for cough in children, for example, under 6. So it is more difficult to give parents something to take away with them for the treatment of children, for example. But the same principles of fluids, rest, keeping them comfortable apply as they do for adults. But if a baby has trouble breathing, then saline nasal drops can help that, and also slightly raising their heads in a cot or on a bed with pillows, if they're old enough, can help if they're getting a tickle with a cough, and that's keeping them awake at night, and their parents, of course.